I'm Andrea Lamphiear. I'm a radiologist.
I'm Dr. Rachel Preisser. I am a breast imager and one of the founders of Grace Breast Imaging and Medical Spa.
So Grace, the idea of Grace actually started long ago when I was very first in training and just realized how unpleasant breast imaging can be for women.
Our vision has always been to improve access for women in underserved communities, to give women the confidence to know that when they're seeking care, they are being seen by an expert, they are being imaged on the latest technology, and that whatever the answer is, they can be confident in that answer.
Being women-owned and operated and designed has been an amazing privilege because we have been able to take all of the pain points and all of the negatives that we have experienced as patients and try and fix that. And we really did that just to try and encourage people to come in and have a different experience. Really, from our standpoint, there are two things. Number one is just the atmosphere, and if people feel like this is self-care and less like healthcare, it becomes less scary. And then the second part of it is that we both have a passion for young women and their risk. And cancer in Iowa is really scary, and we want to get those women in at a younger age. We want to educate them about breast imaging.
And as we were going around RSNA and looking at all these different platforms to invest in, I remember one of our vendors in particular, Mike from Cassling, he was like, "You have to see this, you have to see Be Brilliant." And I was like, "I don't know, Mike, I don't know." But it took just a few seconds of seeing the images. It was almost like, oh my gosh, this is something different. It is something that really is going to change the way we are able to look at breast tissue.
Hi, I'm Megan Peterson. I'm the lead mammographer at Grace Breast Imaging and Medical Spa. With the new Siemens machine, the actual time frame that we use for the imaging itself is a lot less than the old machine. Most patients on their first time have high anxiety or have a family history, have high anxiety, and feel like sometimes people rush them through with the exam time having, maybe 15 minutes for an exam, where our imaging is maybe 5 minutes compared to 10 minutes at a different machine, where we can actually spend the time to talk to the patient and make them feel like a patient and not a number. I like the wide angle on this unit. I feel like we see a lot more defined images, defined landmarks in the breast tissue, a lot more detail for the women that get the mammo on this unit compared to the old ones.
One of the things I love about being a breast radiologist is that we really are in the forefront of advancements in technology in the women's health space. And Siemens Be Brilliant really feels like that next transition with the wide angle. So it really feels like a tool that's going to help us be even better and help our patients have even better outcomes.
I do think that Be Brilliant has some features that are pretty awesome to help our patients. I mean, just when you walk in and look at it, it's beautiful. It's got the glowing behind it. People may think that's superficial or silly, but when your mental status is relaxed and calm, the experience that you go through is going to be better. You're going to be able to tolerate, the compression, which is important for a lot of different reasons. I feel very confident with our equipment that when I see a young baseline woman who's never had a mammo and I have no idea how her tissue pattern looks, I feel much more confident that I'm not going to miss anything with this equipment.
We always say we want to find the cancer before we can feel it. Find it before you can feel it. And the reason we want to do that is because when we find a cancer in its earliest stage, stage 0, stage 1, it's very treatable. And the treatment that we recommend to get to the other side of it, it's easier to go through for the patient. It is less expensive to go through. It is more successful. So we really want to catch cancers when they are small. As I think back over my career, all of the tiny little cancers that I have caught under a centimeter in size, hundreds and hundreds of women have had a chance to get treatment for their cancer and be a survivor of their breast cancer, and that's just so impactful because those are lives that they get to live.